Well, the notion of COPD or the awareness of COPD has been with us for years now, and that stands for chronic obstructive pulmonary disease. The word obstructive means that there is obstruction to airflow. So there is the air passages are abnormal. There is turbulence in the airflow resulting in an increased work of breathing. Uh, the onset is very, very insidious, very, very subclinical, gradual. The important thing is that in many cases, the symptoms can be either shortness of breath on exertion, an unexplained cough. In the case of the chronic bronchitis patients, chronic sputum production. Maybe one day the patient decided to do something extraordinary in terms of straining, physical straining, and they found this a very short of breath, like running on the beach. And that's the first indicator that things are not the same. The point is that the presentation or the onset is very gradual, and the obstruction I was talking about would be appreciated or diagnosed if you do a pulmonary function testing. So the value of spirometry is there in the early recognition of that obstructive physiology. And it's very telling and very compelling, for a patient to see that and say that, I'm already having difficulties. And the important about it is that the disease process can be modified. It can not necessarily normalize completely, but reach almost normalcy depending on how early the offending factors are removed. The offending factors are 90% plus cigarette smoking. Okay, that's stop counting. So by behavior modification, you can actually do enormous benefit to the patient or the patient to themselves by early diagnosis. So the thing to be stressed about COPD is that early diagnosis makes a big difference in terms of natural history, quality of life, and the cost of all the secondary ripple effects of any chronic respiratory illness.